Infection control, bloodborne pathogens, and the use of PPE. Infection control is crucial in hospice care to prevent the spread of illness and ensure the safety of our patients and team members. Bloodborne pathogens are microorganisms that can cause disease and are transmitted through blood and bodily fluids. Let's review some examples of bloodborne pathogens. HIV, human immunodeficiency virus, causes AIDS. Hepatitis B virus causes liver disease. Hepatitis C virus causes liver disease. HTLV, human T lymphotropic virus, causes adult T-cell leukemia, lymphoma, tropical spastic paraparesis, or associated myelopathy, and neurological disorders. Hantavirus, pulmonary syndrome, causes fever, muscle pain, fatigue, shortness of breath, cough, and chest pain. Let's review the transmission of bloodborne pathogens. Direct contact with infected blood causes transmissions that happen through cuts, scrapes, or mucous membranes, through broken skin or damaged tissue, through contact with infected blood on surfaces or equipment. Other transmission routes may include contact with bodily fluids, contaminated sharp objects, contact with contaminated surfaces, medical procedures, needle sharing, mother-to-child transmission, blood transfusions, and rodents. Personal protective equipment, or PPE, is crucial in hospice care to prevent transmission of infectious diseases such as COVID-19, influenza, and tuberculosis, protect patients with compromised immune systems from infections, reduce risk of exposure to bodily fluids such as blood and urine, maintain a safe environment for patients, families, and healthcare workers, prevent cross-contamination between patients and healthcare workers, comply with the infection control guidelines and regulations, enhance patient and family trust in the care being provided, reduce risks of healthcare-associated infections, protect healthcare workers from exposure to chemicals and hazardous substances, demonstrate a commitment to safety and quality care. Common types of PPE used in hospice care includes gloves, masks, eye protection, gowns, hand sanitizers, and respirators when necessary. Proper use, disposal, and training on PPE are essential to ensure effectiveness. Use gloves for all patient contact handling body fluids and invasive procedures. Use masks when in contact with patients with respiratory infections and when patient is experiencing vomiting or diarrhea. Use gowns for patient contact with bodily fluids, invasive procedures, and when patient has a contagious infection. Use eye protection or goggles for procedures involving bodily fluids or when a patient has a contagious infection. When a patient has a wound or an open sore, use gloves and gowns to prevent exposure. If patient has a respiratory infection, use masks to prevent airborne transmission. If patient has a gastrointestinal infection, use gowns to prevent exposure to bodily fluids. Examples of performing invasive procedures in hospice care includes insertion of central lines and urinary catheters. Examples of handling bodily fluids includes interacting with blood, urine, stool, or saliva. Patients may have contagious infections such as COVID-19, influenza, or MRSA. Patients with cancer or HIV have a compromised immune system, and PPE should be used to protect them. Remember to wash your hands before and after patient contact, before and after procedures, after using PPE, after blowing your nose, coughing, or sneezing, and after touching animals. Remember, hand washing is the single most effective way to prevent the spread of infections. Follow this hand hygiene technique to properly wash your hands. Step 1. Wet your hands. Start by wetting your hands with warm water. Step 2. Apply soap. Use a mild soap that is gentle on your skin. Step 3. Lather. Rub your hands together to create a lather. Step 4. Scrub. Scrub all surfaces including palms, backs, fingers, wrists, between fingers, and under nails. Step 5. Rub for at least 30 seconds. Step 6. Rinse. Rinse your hands thoroughly with warm water. Step 7. Dry. Dry your hands completely using a disposable towel. Let's review some chemical disinfection techniques. Alcohol-based disinfectants are effective against most bacteria, viruses, and fungi. Quats, or ammonium compounds, are effective against bacteria, viruses, and fungi. Bleach solutions are effective against most bacteria, viruses, and fungi, but can be toxic. Now let's review some physical disinfection techniques. Heat. Using hot water steam to kill microorganisms. Ultraviolet light. Using light to inactivate microorganisms. Autoclaving. Using high-pressure steam to sterilize equipment and supplies. Other disinfection techniques include ozone disinfection, using ozone gas to kill microorganisms. Hydrogen peroxide mist. Electrostatic sprayers. There are different disinfection protocols. Surface disinfection refers to disinfecting surfaces, including walls, floors, counters, and furniture. Equipment disinfection refers to disinfecting medical equipment, including instruments and devices. Environmental disinfection refers to disinfecting the environment, including air and water. For best practices, always follow manufacturer instructions. Use PPE when handling disinfectants, and ensure proper ventilation. Airborne precautions should be used for patients with airborne pathogens like tuberculosis. For airborne precautions, ensure negative pressure ventilation and isolation rooms. Droplet precautions should be used for patients with droplet-borne pathogens like influenza. For droplet precautions, wear a mask and ensure patient masking. Contact precautions should be used for patients with highly contagious pathogens like MRSA. For contact precautions, wear gowns and gloves and ensure proper cleaning and disinfection. All hospice staff and volunteers must promptly identify, report, and manage infections of our hospice patients and our team to ensure timely interventions and prevent further spread. Report any suspected or confirmed infection, including pneumonia, urinary tract infections, wound infections, or any other illness. The reporting process is as follows: initial report, assessment, documentation, notification, and infection control measures. Staff, patients, or families report suspected or confirmed infections to the primary nurse or clinical care team to make an initial report. The clinical team assesses the patient's condition and determines the need for further action. The clinical team documents the infection, including symptoms, diagnosis, treatment, and outcomes. The clinical team notifies relevant healthcare providers, including primary care physicians and specialists. The clinical team implements infection control measures, including isolation precautions as needed. It is important to track and analyze infection data to identify trends and areas for improvement for the hospice organization. The data collected is used to implement quality improvement initiatives and to keep our patients and our team safe. Your health and the health of our patients matters to us. Thank you for following these practices so that we can promptly identify, manage, and ensure timely interventions.